Well, so we're here to again tell you about breast cancer, because every Monday that's what we do for the month of October, and that's why it's been declared across the world and even on a channel, and particularly on this show as the Pink Month. And for October, we've been having discussions, and for this week, again, we're being joined by Dr. Na Adoko Aite, who is a specialist radiation oncologist from the National Center for Radiotherapy and Nuclear Medicine, the Kolebu Teaching Hospital. Well, today we're here to talk about treatment, the various forms of treatment, whether there are side effects or not, and we'll have some demonstrative pieces around in the studio. And so please make sure that you stick and stay. We have great discussions. Good morning to you, Doc.
Good morning.
Right. And we've been having some recaps about what's the whole problems there are as far as with the breast and what causes it, etc. But today we're here to talk about treatment.
Yeah.
Which forms of treatment usually do we have?
So there are various forms of treatment for cancer. The interesting thing about cancer is that...
You mean breast cancer?
Yes, breast cancer. Well, and for all cancers, because they are pretty similar in the way they behave. And it's that, like I said in the beginning,
yes, please.
Cancer usually arises from a particular place and has the ability to go elsewhere in your body. All right. So the kinds of treatments that you give for cancer must cater for the local area. So for breast cancer, the local area is the breast. And then your armpits, your axilla, we talked about that as well, that the cancer can go into your armpits. So that will be local treatment. Then you also have to target the rest of the body, because the breast cancer has the ability to go to other parts of the body. So that is what we describe as systemic treatment. For local treatments, the main ones are surgery. And surgery is done once we have a diagnosis of breast cancer and we know what stage it is. There are two types of surgery, basically. One is to remove just the lump and a bit of normal tissue around the lump to make sure that under microscope all the cancer is gone. We can do that for cancers that are early. And when we do that, you go back home with your breast. Then we have the more advanced cases when the tumor is more than 5 centimeters. In that case, we cannot do just removal of the lump, because there's an increased risk that you leave some of the tumor behind, and that is not preferred.
And if you talk about 5 centimeters, that's for radius, the size?
Yes, yes, in its longest diameter.
Okay.
Yes. And so when the tumor is more than 5 cm in its longest diameter, then we have to do a mastectomy, where we remove all of the breast. One of the things that patients are most scared of is that they would have all their breasts removed. Well, I'm here to say today that if you come to the hospital early enough, there's no need to take off all of your breast, because the lump will be so small that just excising the lump or taking the lump out of the breast will be enough. And even when we have to do removal of your breast, which is mastectomy, we have plastic surgeons in Ghana who are willing and able to reconstruct a breast for you. Sometimes even at the same surgery where you did the mastectomy. So you wake up with your old breast, diseased breast removed, and then there's a new breast there. And this is something I really want to drive home, that mastectomy is not a death sentence. Okay. Once your breast is removed, there are all kinds of ways of giving you a new breast. It might not be
replacement are tissueless, right?
There are various ways of doing it. You can use the patient's own tissue. And this is good for those of us who have a bit of abdomen, because they can use abdominal fat to replace your breast. That's the one time being fat is beneficial. We can use that to replace your breast. Or we can have what we call prosthesis, and that can be used to replace the breast as well.
That's an externality.
Exactly.
So we have an external. And usually, when it comes to the fears, it means that it's only early detection that results in any preventive effort not to remove the whole.
That's right, and that's what we've been saying, that early detection with effective treatment will cure your cancer. And when that happens, you do not need all your breast removed. Then the other local treatment is radiotherapy. Okay, radiotherapy is basically using high energy to destroy cells, and in this case, cancer cells. So radiotherapy is used in all kinds of ways to destroy microbes, to make it to make it, how would I describe it? To kill microbes, basically. So if you are transporting something and you don't want microbes there, you can use radiation, things like that. But in our particular case, what we do is that we use radiation therapy directed to the site of the tumor. It can be the whole of the breast. Sometimes we treat the upper part of the neck as well, based on the stage of the tumor. And what it does is that it destroys all the cancer cells that are in the local area, and so prevent the cancer from coming back in that area.
Okay.
In fact, there's a lot of study on radiation therapy for breast cancer. And apart from stopping the cancer from coming back at the local site, it's also able to destroy cancer cells in the rest of the body, in a phenomenon that's a bit complicated, but that happens. And so we know that giving radiation therapy adds to improving your chances of living for longer. Then we have the systemic therapy. Okay. And for systemic therapy, what we usually use is chemotherapy and hormonal therapy. Chemotherapy is one of the other things that most people fear, because there are all kinds of misconceptions about them. So what chemo does is that it goes into your body. It's usually given via the IV route, so through your vein. And what it does is that because it's through the blood, it's able to go to every part of your body and then to destroy the cancer cells that are there. It's the special thing about cancer cells are that they usually grow very quickly. And so chemotherapy targets cells that are growing quickly. Unfortunately, we haven't gotten to the point where we can exclusively destroy the cancer cells. So sometimes other rapidly dividing cells are also affected. A typical one is your hair follicle. It's very rapidly dividing. And so if you receive chemotherapy, you may lose your hair. It's not permanent. Once you stop taking the chemotherapy, your hair grows back. And it's actually a very nice silky hair. I keep telling the patients, and they're surprised when it comes. It's usually nicer than the one that you had before. Nice and curly, and people like that. And then the other part of your body where you can have rapidly dividing cells is your gut system, where you eat, where your food goes through. And so it's very common that patients will have a lot of vomiting associated with chemotherapy as well. There are all kinds of medications to help that. And it usually doesn't last for too long. Most patients will have it for a day or two. Rarely you have it for a week. But there's medication to help with that as well. And then there's hormonal therapy. Hormonal therapy is described as targeted therapy. The reason is that not all breast cancers will respond to the hormonal therapy. So we do some special tests on your cancer to find out if you have what we call receptors that will bind to the hormonal therapy and so destroy the cancer cells. So some patients will receive the hormonal therapy and some patients will not receive the hormonal therapy. And usually the hormonal therapy, you do it for between 5 to 10 years and you take it every day for that long.
Okay. Now, we've identified that if you come early, it means that it's been aligned to certain type of treatment. So if it's late, it means that you have a lot more of the chemotherapy,
exactly the point,
etc.
When someone comes in early, their treatment is usually quick. Sometimes the number of cycles of chemotherapy they require is less, and the side effects are so little. But when the patient comes in an advanced stage, sometimes even the first chemo you give may not work, and you have to try other chemotherapy agents, and that's what makes it a bit risky.
There are always a lot of myths and misconceptions and people's mindset about some of these treatments. What are they, and how do you assuage your patients' feelings?
The myths there are too many to count. And a lot of them are funny as well. So there's a belief in Ghana that the woman's breast is linked to the heart by a certain thread. And so when you remove the breast, then the heart will die. Then obviously you will die. I've been a doctor for a while. I haven't found that thread yet. I know that there's no thread that connects your breast to your heart that would make you die when we remove your breast. Other people also believe that all breast cancer patients have mastectomy. like I have described. That is not true. Depending on the stage at which you come, you may not have all of your breast removed. Patients also believe that once you do surgery, you die. That certainly cannot be true. We have too many people who've had surgery and are alive. So it's certainly not true that if you have surgery, you die. What do we do to assuage their concerns? We are lucky to have a lot of survivors who are willing to talk to them. And there are some NGOs, Run for a Cure Ghana, Reach for Recovery, and they have advocates who are patients who have been treated, survivors. And they would usually talk to these patients, show them their own breasts, tell them their story. And a lot of the time, you're able to get them to believe.
And I'm sure in the conclusive part of our episodes for the month, we'll have some time with the survivors.
That's right.
But we have to let you go because we're just perhaps not having enough of the time to do many of the discussion. I have here with me, what is this?
So this is a prosthesis.
Prosthesis.
It replaces the breast after mastectomy. If the patient decides that they do not want to have reconstruction done, then they can put this in their brassiere.
So you fix this?
Exactly. It comes in various sizes, as you can see. There's a rather small one. This will probably fit me nicely if there was no breast there.
Yeah.
And then
which size will that be?
Maybe
perhaps maybe
36 C.
Okay.
Yeah. Yeah.
This one is bigger for my size.
Yeah, we have it for every size, and so you can put this in, and when you are walking around, nobody knows that you have, and you've had a feel of it. It's quite soft.
Yes, very soft.
So even if someone touches you, there's no indication that you have no breast.
Yeah, sure. Yeah, usually breasts are soft like that. So. Well, that will be it. And we've been having great discussions. And I know that we'll continue again next week, Monday.
Yes.
We'll try and come into the studio as early as possible to make sure that, as far as we're concerned, we're able to give you the best as far as the advice is and what you need to do. We've been speaking to Dr. Na Adoko Aite, who is a specialist radiation oncologist from the National Center for Radiotherapy and Nuclear Medicine, the Kolebu Teaching Hospital. And thanks for joining me this morning. Okay. It's a pleasure. I know we took you through a lot of hassle to get here, but we know that you have to go continue your work.